Hello everyone, good evening, and thank you for joining our webinar today. I'm Alka Gupta, Marketing Manager of TriBeCa Care, and I will give a brief introduction about the webinar, and then I'll welcome our speakers on board for this webinar. So this webinar is for 45 minutes and you are being muted upon your entry. If you want to ask a question, you can type in the chat box. We will address all your queries towards the end of the webinar. In this webinar, we are glad to present two renowned doctors in Kolkata, Dr. Kushal Nag, orthopedic surgeon with more than 14 years of experience in ankle and foot surgery. He's associated with institutes like Apollo Hospitals and CuraFoot Clinic. We also have on board today Dr. Tanmoy Bose. He's consultant rheumatologist with 19 years of experience in internal medicine and pain management. He's associated with institutes like Narayana Health and CuraFoot Clinic. We also have Sudarshana Basu, business head of CuraFoot in this webinar. So let's welcome our speakers. And now I will hand it over to Dr. Nag. Welcome, Dr. Nag.
Yeah, hi. Thanks for the short introduction. And I'd like to congratulate TriBeCa, Team TriBeCa and CuraFoot for taking this opportunity to reach out to a lot of our elderly patients who, for want of better options during the lockdown, have been suffering from foot pain and hip pain and knee pain issues. So I think this is a good step. And without much ado, I'll share my screen and start my presentation. So what we're going to do, the way we're going to play it out is that I'm going to talk about foot and ankle mobility and pain issues, while my colleague, Dr. Bose, will talk about hip, knee pain issues and back issues, if I'm not mistaken. So let me go back to my presentation. I think you can see my screen here. Let me go full screen. Okay. So what I'm going to do, so the topic today is all about managing common pain and movement problem. The focus of this talk would be more on the elderly and our people who are 50 plus, right? And not our young patients and young kids. So we're going to start. I'm going to start talking about. We're going to talk about common musculoskeletal pain issues, including the foot, knee, hip, and back. So my focus will be on the foot. So we're going to start talking about the most common foot and ankle pain issues that we face in our everyday lives. I think the commonest would be heel pain, right? I mean, if I get 100 patients of foot pain in my clinic, almost 75 to 80 of them would be with heel pain, right? And it has a specific name, and I'm sure quite a few of you would be aware of that. It's called plantar fasciitis, and it's pain which is on the undersurface of your heel, and it is the worst on waking up, and it is very painful if you wake up from your sleep and try to take a few steps, and as you walk, the pain reduces. That's the classical symptom of plantar fasciitis. So sometimes you may have swelling or redness. Often the not is not there. Causes obesity, excessive walking, sporting activity, tight plantar fascia, and flattening of the artery are some of the few common causes associated with plantar fasciitis, but it's very difficult to pinpoint one cause and say this is the reason why you have plantar fasciitis. So most of the causes that we're talking about are associated causes, right? They don't have a direct correlation for causation. The treatment of plantar fasciitis is actually very simple, and one of the very great mysteries of medical science today is how badly we treat plantar fasciitis, right? I mean, I've had patients who've been treated for rheumatoid arthritis with injections, with immunosuppressants, and it didn't help, right? So very simple. There are 2 or 3 things you need to do. One of them is basically physical therapy, which involves stretches. Sometimes local ultrasound helps. If it's symptomatic, as it is painful for you, we do advise you to take NSAIDs or painkillers for a limited amount of time. In the very rare cases, you may need surgical intervention, but that's very less. So let's not talk about that. But mostly the most common thing that we do is to teach our patients physical therapy and give them orthosis. So what is orthosis? Orthosis is basically a modification of your shoe wear, where if you go to the developed countries of the world, if you go to the UK, US, or Singapore, you'll have those podiatry shops where they will be selling you heel offloading insoles, right? Which will make sure that the painful point in your heel is offloaded, so that when you wear it and walk, you don't feel the pain. So it's basically custom made orthotics to help hold the adjustments and position of the foot for healing. So a deep heel cup gives you more stability for the hind foot, and of course offloading. And offloading at the heel area also gives relief. So custom orthotics improves heel pressure distribution. So, and remember, most of these patients with plantar fasciitis will also have coexistent foot deformities like a flat foot or a Cavus foot and many other smaller niggles. So a custom insole would more commonly take care of all of these problems in one go. So what happens is usually now today my patients elsewhere would get prescribed a silicone heel orthosis, which works for the first few weeks and then it doesn't, because what happens is as you keep wearing it, it compresses and the elasticity goes away. So it generally works for a couple of weeks and then you're back to square one. So the ideal way of doing it is physical therapy, stretches, and then heel offloading with either a custom insole or a semi-custom or a ready-made deep heel cup insole. Achilles tendinitis is also another very common symptom, specifically in the elderly population. What happens is in Achilles tendinitis, you have pain on the posterior aspect of your heel. So in plantar fasciitis, it's on the undersurface of your heel. In Achilles tendinitis, it's on the back of your heel. So most of my patients would either have a bony heart or a bump behind the heel with pain and pain on palpation, pain on pressing that area, and of course pain on movement. So what this does is basically there is tenderness and a lump there, which signifies an inflammation. And most of my patient will find it difficult to wear a closed shoe. They will usually be more comfortable in a chappal or a sandal. So what are the causes? The most important cause of this is idiopathic or age related. So as we age, our body, which is a machine, also degenerates. So you have knee arthritis, hip arthritis, foot arthritis. So this is also a part of the spectrum of aging. Not everybody will have it, but some of them will. It can also be caused by certain other medical conditions like gout, RA, rheumatoid arthritis, and Angst-Pont. And the bursal impingement between the Achilles tendon and an excessively prominent posterior superior aspect of the calcaneum or the Haglund deformity. If you look at my cursor, this pointed tip is what we call the Haglund's deformity. So what happens is you see this shadow, this is the Achilles tendon. So this Achilles tendon rubs against this pointy part of your heel and causes the bursal inflammation, which is responsible for the pain and swelling. So the idea behind this is, of course, in very advanced cases, you can't do without a surgery. But in literature, if you look at medical literature, almost 75 to 80% of patients can get away without a surgery, can get away with a surgery if they use certain physical therapies and orthotics. So what do we do for orthotics or appropriate shoe wear? We we do a heel wedging. So what happens is we put the foot in slight equinus. By equinus, I mean if the foot falls slightly down, this bony bump moves away from the Achilles tendon and doesn't cause impingement. So then what happens over a period of time, the Achilles tendon heals itself. So we also, as an adjunct to treatment, we also add icing, certain painkillers, certain nutritional supplements for healing the already damaged Achilles tendon. But I think the most important part of the non-operative treatment of this Achilles tendinitis is actually a custom-made, a heel-wedged insole, which you can wear either inside your business shoes or even inside your chappals at home. Of course, 80% of these patients will heal with this. 20% or those who are very advanced with a very big bony bump and swelling will end up with a surgery. But having said that, I always ask my patients to try this out first. This is a very easy, simple to use, non-invasive method of treatment. And if this works, you are saved from a surgery. So I think this is a very important part of treatment for Achilles tendinitis. Adult flatfoot is also a very common deformity, and I seem to notice it more in my female patients, and I don't know why. Maybe there is a propensity for the Indian female to have flatfoot more than the Indian male. Not that it doesn't exist in the Indian male. So what will happen is your foot will gradually start becoming flatter, right? If you start becoming flatter, you will have pain on the inner surface of your foot. That's where the posterior tibial tendon is. That's this part of the foot. If you follow my cursor, this is the part of the foot where you start having pain, and you notice the flat arch there. So you don't really have any arch. So this deformity will cause progressive flattening of the arch and shifting of the heel outwards. So you'll have a valgus deformity. So if you look at a flat foot person from behind, you will notice that the heel bends outwards, and the inner part of your shoe or your foot is actually the one which is rubbing against the floor. So if you look at the shoe of a flat-footed person who has been wearing this shoe for over a year, the medial or the inner part of the sole of the shoe will get worn out faster than the outer part. So what are the causes? The most important cause of an adult acquired flat foot deformity is, of course, aging. So as you age, the ligaments, tendons, and the bones of your body degenerate, and the arch starts dropping. There are also other important reasons for a flat foot deformity, which may be due to a tendon dysfunction of the posterior tibial tendon. Overweight, obesity contributes to adding to the deformity. So 90 or 95% of the patients today in the community would have a flexible flat foot. What do you mean by a flexible adult flat foot? A flexible adult flat foot is a foot which can be mobilized, as in you can move the foot in and out, up and down. So in these flexible adult flat foot patients, we don't do a surgery. The only indication for a surgery in an adult flat foot is a rigid flat foot deformity. Only if you have a rigid flat foot, that is, you can't move your feet in and out, then only a surgery is recommended. 90% of the times with a flexible flat foot, you don't need a surgery. What you need is actually orthotics, which has medial wedging and a medial arch. So what it does, so custom orthotics are usually preferred. So what that does is there's a full length or a 3/4 length device which you may use, which is a custom orthotic. Most often a medial wedge and a deep heel cup is used to control the hind foot. And so these custom orthotics, we can straighten the foot out so that the foot is aligned properly and the arch develops. And in the medium to long term, the pain and disability with which the patient has come to me will gradually disappear and we can give him good relief. So these are the orthotics that we commonly use for people with acquired fracture. The more severe ones will usually have a UCBL. And if you're wondering what UCBL stands for, it stands for University of California at Berkeley Lab. So it's basically a orthotic. It was designed in the US 50, 60 years ago, and it has stood the test of time for people with very, very advanced flat foot with navicular drop. The ones on your left, these are the ones which are used normally for people with moderate or mild flat foot. Cavus foot is significantly less common. I will maybe get out of 10 patients, maybe one will have a cavus foot, but this is a foot is just the opposite of a flat foot. You will have a higher arch. If you look at this photo, if you this schematic diagram, this is a much higher arch than the normal arch. So what happens is cavus foot per se is not a problem. What the problem is, people with cavus foot will have peroneal tendinitis and heel pain. So what happens is, due to the changed architecture of the foot, a patient who is flat-footed will have pain underneath the heel, which is plantar fasciitis, and peroneal tendinitis is basically inflammation of the tendon on the outer aspect of the foot. And when you are, and these patients are very prone to getting repeated ankle sprains. So one of the problems with the cavus foot is that your foot is slightly bent inwards. So when you're walking on uneven ground, you tend to get frequent ankle sprains. So many of the patients who would come to me would usually come to me with a complaint of frequent ankle sprains, and then you will find out, oh, you have got a bad cavus foot. A cavus foot is significantly more rarer, as I've already mentioned, but it is quite common in people with neurological disorders such as cerebral palsy, Charcot-Marie-Tooth disease, spina bifida, polio, muscular dystrophies, or even post-stroke. In other cases, cavus foot, the high arch may represent an inherited structural abnormality, right? What you do for these, a cavus foot is also eminently treatable by a custom orthotic, which is just the opposite of what we do for a flat foot. In a cavus foot, we do a lateral wedging with a inbuilt arch to support the arch. So what it does, it reduces the instability of the ankle, causes reduction in injuries when you're walking, and of course gives relief from the pain of plantar fasciitis and peroneal tendinitis. So these are very, very well-established treatment protocols in the West. However, these are new concepts in India, and I believe our Indian patients also deserve to be treated at par with our international customers. Hallux valgus also is a very common complaint. It's a condition where your great toe bends inwards, and it is mostly a problem of people wearing shoes, right? You will rarely find hallux valgus in a farming population or a patient who is a farmer in the interiors of the country. It's mostly very common in people who have been wearing shoes. And as a country, as India progressed from being from a rural semi-urban to a mostly urbanized population in the days and months and years to come, this problem is going to get worse. So in the West, hallux valgus is a very common problem. In India, is also increasing in intensity. So the most important cause is inappropriate footwear. Sometimes it can run in the family. So if you have your mother or your father's side having a hallux valgus, you too can get it. Foot injuries is also a rare cause, as is deformities present at birth is also quite rare. So inappropriate footwear and inheritance is a very common reason for why you get hallux valgus. One of the ways we treat it, of course, if it's very advanced hallux valgus with crossover toes, as in one of the toes riding over either the second toe or the great toe riding over each other, then of course you can't run away or you can't escape a surgery. But in those milder cases where you still don't have crossover, you can be treated by conservative method, which is by offloading the first MTP joint. So what happens is when you offload the first MTP joint and you correct the medial arch, the pressure distribution changes. So the rate of progression of the hallux valgus reduces. So for those patients who do not want a surgery or who would want to avoid a surgery in the long run, this is the um, best way to prevent further worsening of the deformity. But as a caveat, let me mention that whatever deformity you already have will remain as it is. It will never get back to your normal state. But of course, with offloading, you can prevent further worsening of the condition and imminent surgery in the recent future. So these are one of the very common ways to treat a hallux valgus with a custom orthotic. Hallux rigidus is also an arthritis or a painful inflammation of the great toe joint. This is also very common. This is mostly age-related, like you have knee arthritis or foot arthritis. This is a type of arthritis where the joints degenerate and you have pain when you walk. Most of the pain happens when you try to walk fast or when you try to run. So a person who has hallux rigidus will have a unseemly or a big bump or a bony swelling there, and they won't be able to walk very fast or run. They would mostly be walking very slowly, and that would also might cause pain. Most of the causes are either post-traumatic, degenerative, as I've already mentioned, which means it's age-related, and a sequelae to gout, which is significantly rarer. So what are the treatments? Of course, surgery is an option in the very advanced cases where pain is something which we cannot treat with analgesics and orthotics. But in the initial stages, we do treat our patients with shoe modifications, orthotics, medical therapy, and physical therapy. So what are the devices? Again, offloading the first MTP joint and giving a stiff insole. So what a stiff insole with offloading does, it prevents flexion at the MTP joint, and that gives you pain relief. So if I can modify your gait by giving you a stiff insole and an offloading insole, you will have significantly less pain when you're walking, and hence the need for an immediate surgery gets obviated. So of course, this is one of the tricks by which we can prevent you from undergoing a surgery immediately or maybe even postpone one. So metatarsalgia is again very common, which is basically pain on the undersurface of the forefoot, right? I mean, a lot of my patients would come and say, "Doc, I have pain on the undersurface of my forefoot and pain here," right? These are the area where you have pain, which we call metatarsalgia. There are various causes. One could be either Freiberg's disease, poorly fitting shoes, stress fractures, or even the makeup of the bony architecture of your feet. So there are many reasons why you have it. So what may be the symptoms is very, very obvious: sharp aching pain or burning pain, shooting pain, a feeling of having a pebble in your shoe. There are many, many common reasons, many common symptoms that you may have. And what are the treatment for this? Very simple. The treatment for this is to have a metatarsal bar or an offloaded forefoot. So if I can, suppose I can localize the pain. Suppose you have pain on the undersurface of your second metatarsal head. So if I know that by physical examination, I can ask my orthotist to offload the second metatarsal head. By doing that, it relieves the pressure when you're walking and hence gives your body the time to heal the injury there, right? So, and if you have more than 2 or 3 metatarsals which are causing pain, we can obviously give you a metatarsal bar, which can help heal the injuries as time goes by. So what do we do? We do a combination of forefoot foam adhesion with a med bar or a metatarsal bar with a minimal arch raise, soft cushion, and heel stabilization. The idea is to stabilize your foot and slightly mechanically alter the gait so that the pressure points which were there earlier doesn't exist, and you have relief from pain. So I will end my talk here today, and I have tried to cover most of the common foot ailments today. There are many more that can be discussed for want of time today. I will end my discussion here, and I will hand over to, I think, Dr. Bose, who will be taking over from now on.
Yeah, so welcome, Dr. Bose. You can start with your presentation.
Yeah, hello. Good afternoon, everybody. Allow me to share my screen. Yeah, am I audible and the screen can be viewed?
Yes, absolutely.
Yeah. I'll be talking about common pain and movement problem. And let's start with back pain. Now, perhaps this is the commonest complaint in our day-to-day life. And I must reassure everybody that 90% of the back pains are benign in origin. That means they are harmless. And if we categorize back pain into 2 divisions, the first one is a mechanical reason which is approximately found in 95% of the patients. And the second one is called the inflammatory region, which is actually caused by ankylosing spondylitis, which we find very commonly in young males and sometimes in females. So the mechanical reasons are basically due to bad posture or heavy weight lifting or injury or trauma or sometimes jerking or jolting or prolonged poor posturing. What happens is that the lumbar spine is the most affected joint or the spinal area because it connects the upper part of the body with the lower part of the body. So it acts as a pivot. It's a flexion. It's a hinge actually. So more you bend forward and lift thing up again from the ground against the gravity. At the same time, if you are heavyweight, you have got a pot belly, your lumbar spine is more stressed. So exercise is a very important thing. Everybody should ensure that you should take care of your spine. Another part of the spine, which is very important, is the cervical spine. Cervical spine is the most mobile spine part of the spine, and always mobility comes at an expense of stability. The same stands for lumbar spine, which is much more stable, but not that mobile. So when there is a spinal pain, the muscles around the spine, they tend to ensure that the spine is not moving much. So they go into an involuntary flexion or involuntary contraction. And after some time, this contraction will increase pain. It will develop pain. So the muscle pain is also a component of the low back pain. Now, there are different types of pain. Pain which is localized in the low back, pain which radiates along the buttock and the back of the thigh to the legs, which is often commonly known as sciatica. If you get this kind of pain, you realize that one of the nerves in the lumbar spine, which are coming out of the spinal cord, is pinched by the disc, which is prolapsing between two vertebrae. That is a serious condition. You have to address it because if the nerve is compressed for a longer duration, it might result in a weakness of the leg, even end up to a paralysis. However, before you reach that state, you will be getting signals from your body that you are having a low back pain, which increases in bending forward or standing for a longer time. Now, another pain is that a pain that occurs mostly when the patient is getting up from the bed or after a period of rest. These type of pain are called inflammatory pain. However, more you walk, more you run, more you play, more you keep moving, this pain gradually diminishes. This is a very classical sign of an inflammatory back pain, and often it is a telltale diagnosis that the patient is suffering from a disease called ankylosing spondylitis. Remember, there are certain red flag signs. Red flag signs means the signs, if you get, you have to immediately consult a doctor. A pain that wakes up in the middle of the night, that is a dangerous type of pain. A pain that increases with cough or straining or jolting, that is an important type of pain. Pain that dramatically increases in intensity without giving any warning. You have to immediately consult a doctor. That implies that either there's a deficit in the bone, there's a fracture, there's an inflammation, or there may be a malignancy in the bone. However, there are other causes of pain which is caused due to poor posture of your leg, flat feet, muscle flaccidness, uneven pelvis, and elderly people who have osteoporosis often develop microfractures, thereby reducing the height of the spine. Sometimes these people lose height. What are the treatments? Mechanical back pain are best treated by physical therapy, traction pulley, sometimes acupuncture and yoga therapy. Now, you have to do an MRI, X-ray preliminary, followed by an MRI of lumbosacral spine or the affected area to find out what exactly the problem is. Most of the pain, as I've reassured all of you, that it is benign. Mostly it responds well with local steroid injections, sometimes even oral tablets do. And losing weight is a very important thing, along with physical rehabilitation therapy and tractions and other maneuvers. TENS is called a transcutaneous electric nerve stimulation device. It helps excellent way to deliver electric stimulus straight to the affected area. and that cause, if you give it in regular intervals, then the patient may find much better. You have to change your footwear if your pelvis is not in a horizontal line. That is often checked by the doctor. If your one foot is affected more than the other foot, the entire thrust of the weight reaches the pelvis and it transmits to the lumbar spine, which is again affected very badly. Hip pain is another component. Hip is a mobile joint. It is a ball and socket joint. If you can see the image in the PPT presentation, the hip joint is a very important joint. In Indians, hip pain is pretty less than the Western world because we used to, previously our parents or our generations ahead, they used to use the Indian type of toilet where we used to flex our hip very much, and that causes very good movement of the hip and preserves the hip. However, hip pain will ensure that you will have a pain at any one side. It's very unlikely that you have a pain on both sides of the hip. Most of the diseases, they cause one-sided pain. You might feel that you are limping, you can't bear weight on that foot, there is loss of motion. Sometimes you can feel the warmth and swelling over the hip, and you cannot lie down on that side of the body with the hip in a dependent posture. The commonest cause is osteoarthritis of the hip. Very important cause, which I would like to mention because we get in our practices that often patients of rheumatology are put on steroids. Those who don't consult rheumatologists, those who consult some other neurologist or general physicians, sometimes homeopathy, they are put on steroids for a long time, and long time steroids causes damage of the ball of the hip joint. And if the hip joint ball is damaged, there is no other alternative apart from replacing the ball of the hip joint, which is called total hip replacement surgery. And the phenomena by which the hip joint ball is damaged is called avascular necrosis of the femoral head. This is a very, very precarious situation. And interestingly, patients who suffer from ankylosing spondylitis, we get total hip joint destruction in an age as young as 25 to 30. So ankylosing spondylitis is a disease of young age, particularly of males, characterized by early morning stiffness of low back, needs to be consulted by a rheumatologist as early as possible. However, hip pain which are caused due to osteoarthritis and age-related problem or weakness of the bone can be managed very well by exercise. You have to restrict certain activities which causes increased stress on the hip joint, and you have to ensure that you are warming up slowly and cooling down slowly. The exercise has to be guided and graded. It should be under somebody's guidance, and you cannot go for a hectic exercise right from day one. It has to be very slow exercise. The changing in sleep posture, you have to use some kind of devices by which the hip is not flexing more on the other leg, just as shown in the image. You can use some kind of orthosis so that the hip is at rest when you are sleeping, so that the healing process can be accelerated. You have to ensure that you are not gaining weight. Once again, hip is a weight-bearing joint, and when you're climbing stairs, the hip joint flexes and lifts your leg against the gravity, which is very important. So if you have got very heavy legs, particularly in elderly females who are hypothyroid or obese, they have got lots of fat deposit in the thighs and the calf muscles, so the hip will get very much stressed and strained. So you have to avoid long periods of sitting with legs crossed, trying not to stand with weight on one hip. You have to maintain balance in both the legs, and you have to maintain a body weight which is actually calculated by body mass index. Talk to your doctor. You will be provided with medicines. Always ask for a diagnosis and always ask for a prognosis from the doctor, that how it will be treated, whether there is a long-term treatment, how will I get better, do we need any surgery or not. Now, gait analysis is a very important thing. Actually, whenever we get a person with a hip pain, we ask him to walk in front of us and try to find out that on which leg he is giving more pressure on, or whether the pelvis or the hip level is getting tilted at one end or other. That means that part of the hip is bad, or he's not being able to take weight on that part of the head. So if you analyze the gait, you can reach the diagnosis properly. And if you don't correct the problem with your hip joint or the lower limb, what happens is that continual use of this kind of altered gait will cause a change in the dimension or the shape of your spine. Ultimately, you will have a snake-like spine. You might develop a scoliosis deformity, which is actually not a problem of the spine. Rather, it occurred due to unsolved or uncorrected hip problem. There are pain related to arthritis. Arthritis is basically inflammation of a joint, which is characterized by pain, swelling, redness, high temperature, and there will not be possible to execute a particular function by this joint. These 5 characters are called an signs of symptoms of inflammation. Often we confirm inflammation by checking a blood test called ESR and CRP, which are usually raised in an inflammatory condition. But in a non-inflammatory condition, just a simple osteoarthritis of the knee or simple osteoarthritis of the hip, you won't find ESR and CRP levels high. Sometimes if we have confusion, don't try it at home. We do as a doctors, we give a very short course of oral steroid and patient can respond dramatically, because inflammatory pains or inflammatory arthritis, they respond excellent with steroids, and sometimes we diagnose these things. So there are many reasons where which can cause arthritis. The commonest one is a reactive arthritis. It is an arthritis of a lower limb, usually occurring in the knees or ankles. They do occur in one side only, not both sides together. They occur after a period of some kind of infection. It may be sore throat or diarrhea or urinary infection, and suddenly there is a swollen joint, and it is a self-limiting, but we treat with painkillers. Gouty arthritis of the joint at the base of great toe is a very common phenomena. People who are elderly, particularly the males, young females who are in the age group of 20 to 40 are least affected with gout. Elderly males are mostly affected, and there are risk factors of developing gout if particularly the patient has got a type A personality or high uric acid or taking lots of red meat or having alcohol or seafoods. There are conditions which causes increase in gout. So gout is a typical condition where the base of the great toe is swollen, inflamed, red, and even a patient won't even bear a touch of a hair. So that is the severity of gout, often mimics a septic arthritis. Rheumatoid arthritis is another inflammatory arthritis which occurs mostly in the small joints of the hand. People feel very stiffness early morning. They can't fold their hand. They can't use their hand to open bottles or use food or anything. So these joints are often swollen. Rheumatoid arthritis is excellently treated by a group of drugs called disease-modifying anti-rheumatoid drugs. We are seeing plenty of rheumatoid arthritis patients, and they really do well. However, it is not a curable disease. Only 8 to 14% of the patients of rheumatoid arthritis get cured over a year with or without medicine. That is just for an information. So, however, I will tell you, this is a very important thing, that joints and the skeletal structure of our body is basically the frame of a human body. If you consider a house, they are basically the building blocks. They are basically the concrete structures. So you have to take care of it. If the concrete structure is weakened, the entire body will crumble. So you cannot put extra weight on a concrete structure which God has gifted us, and He has calculated the weight which you can put on maximum, not beyond that. If it is more than that, naturally the joints and the bones are going to be affected very badly, and you have to consume painkillers unnecessarily. Keep going with stretching and exercises that should be under guidance. Don't jump if you have a low back pain. That's a very simple policy, because it will increase if you jump low. So exercises has to be guided under guidance and should be graded. Start with light exercises. Aerobic exercises are done to lose weight, and there are certain weight bearing exercises which are done to strengthen muscles. You have to get this difference, and you have to consult a proper physical rehabilitation therapist. There are other managements, particularly in the foot, which Dr. Nag has already discussed in detail. He had given a fantastic deliberation. I will cut short in this pain related to the foot. In our domain, we get gouty arthritis and rheumatoid arthritis or reactive arthritis, and sometimes psoriatic arthritis, which affect the foot and which needs basically anti-inflammatory treatment with different steroids or painkillers. Obviously, they are used for very short term, and the disease-modifying drugs, they take care of rest of the disease, which are not at all painkillers or steroid, but you have to continue them, and there has to be a dietary modification and lifestyle modification. Just to give you an example, ankylosing spondylitis, rheumatoid arthritis, psoriatic arthritis, all of them increase in a person who is using tobacco or smoking. Thank you very much. If you have any questions with me and Dr. Nag, we can answer them in a later time. Handing over back to the moderator.
Thank you, Dr. Bose, for enlightening us. So as we know that the world is facing this COVID situation, the COVID crisis, and elderly are the most affected ones. So the situation is such that going out in such scenario is very difficult for seniors, especially if even if it is a routine doctor checkup. So TriBeCa is delighted to announce assisted telemedicine platform, Nirbhar, for senior citizens for whom it's still a challenge for them to go out and see doctors. So I'll share the screen. So TriBeCa is launching their assisted telemedicine platform for seniors who are 60 plus. We understand that technology is a problem for most of us, for seniors, where it's difficult for them to consult to the doctors via phone or online video calls. So here we are helping the seniors via assisted telemedicine platform, wherein our care managers will help them to connect with the doctors, their favorite doctors, their doctors through a video call or a WhatsApp call, and they will follow the COVID protocol. They will wear the PPE kit, and they will measure your BP, pulse rate, SpO2, thermal screening will be there, so that that protocol is maintained, seniors are safe, and we can help seniors to connect to their doctors. The method is simple. Most of us who can use WhatsApp, they can send hi to this number 833-691-6693, and we will assist you to book your appointment for your favorite doctor, the doctor you want to consult. Or you can call on the number shown below, 9830-794890. So you can also call at this number, and you can book appointment through for telemedicine calls. We also understand that not all calls or consultation can be done online. So our clinics are open, and these are the few addresses of our clinics that are open, and you can walk in, you can meet our doctors, Dr. Nag, Dr. Bose, and many other doctors. So we have some clinics at near Acropolis Mall. We have one clinic near Apollo South City Center 1. We have TriBeCa Care Clinic at Ratalla, and we have also clinic at Apollo Hospital.
Yes, so, I would just like to say something, add something to this.
Yeah, so that's
so if you would like to get your parents, or you would like to come over and meet our doctors, we are available in these 4 clinics. Along with this, we are in different cities as well. We are present in Bombay. We are shortly going to be there in Delhi and Bangalore in some of the Bata stores. So you just have to call up the number that was shown, and we will be able to help you. Thank you.
Yeah. Thank you, Sudarshanam. And we also have, we are now towards the end of the webinar, and we can take questions if you have. So we have one question from Pooja. So she's asking what exercises should be done for lower back pain. Dr. Nag?
Yeah, I think I'll ask Tanmoy to answer this question because he covered the back pain issue. Tanmoy, would you be happy to take this?
Yeah, thank you very much. The question is, what are the exercises to be done for a low back pain? Actually, it will be very, what shall I say? It will be a little bit gray if I just prescribe some exercises. First, I need to know your body weight. How heavy are you? And what kind of back pain you're having? And how old are you? That these things are very important. But if I consider that you are having low back pain, which is due to mechanical reasons, perhaps, which you will realize that it increases when you're standing for a long time, or you are maintaining a particularly, it's a postpartum back pain. Okay. And when was the delivery? When did you deliver your baby? Jan. So it is 6 months down the lane. And is it in a pinpoint pain, or is it spread over a particular area? Do you think it is due to spinal anesthesia? Okay, it's a spread pain. Okay, so I am sure you're feeding your baby, and are you back to your normal body weight, or is still you're heavy? I don't know about your height and weight actually. That's why I'm asking. That's an issue. That's an issue. So I'm sorry, but I have to tell you that you have to avoid prolonged erect posture or bending down to lift heavy weights or something like that. I know there is a baby, and when you're nursing the baby, you have to bend down a bit. That's a quite obvious thing for a mother to taking care of baby. But when you are having a free time, always do some back stretching exercises. You lie down on your bed on your tummy, which is called Bhujangasana. If you follow the asanas, if you try to do some Bhujangasanas and Salavhasanas, these are two asanas, you can find it at the internet. So the back stretching part is very important, and avoidance of forward flexion and erect posture for a longer time is very important. Please mind your diet. You need to lose weight because postpartum weight loss is often a challenge, but mothers are successful in losing weight very well. You need to consult a nutritionist if you want, but lose weight is good for your health, because you need to take care of your baby for next 1.5 to 2 years, particularly the lactation part.
Thank you, Dr. Bose, and thank you, Pooja, for asking this question.
Hello. Hello. Hi, I'm Madhumita here.
Yes, please ask. We can hear you.
I had a question. I have plantar fasciitis, which has progressed to Achilles tendinitis now on my left foot. So how do I go about it? I have tried everything, physiotherapy and exercises in the past, but I cannot do it for a prolonged time. So I wanted to know what is the remedy for this?
Okay, so let me take that. May I know your age, ma'am?
I'm 50.
Okay, so and how long have you been having this problem?
I've been having it for the past 10 years.
Wow, 10 years is a really long time
Yes.
to have this problem. But I think this is not rocket science, right? And the problem that I face with many of my patients who come with plantar fasciitis for 2 years, 3 years is that they've done everything except the plantar stretching exercises. So what happens is most of the physiotherapists will teach you your calf stretches, right, which is very easy to do. But the plantar fascia stretching is a bit different from the calf stretches. You can Google it, plantar fascia stretches, or maybe one day you can drop down in the clinic. I can show you personally. And of course, I need to check whether you have any cavus deformity of your foot, because people with cavus foot are more prone to having these long-standing plantar fasciitis, and they don't really understand that, and they suffer in silence. So I need to check out a few things, and of course teach you the exercises and give you offloading orthotics, so that at least you can carry on with your daily activities without too much of a pain. But it's something that can be solved, and you don't need to suffer in silence. Come down one day and we'll have a look.
I'm in Bangalore actually.
Oh, oops, okay.
I'm calling from Bangalore. So it's a bit of a problem for me to consult personally. Can you show me some exercises on the
I think what I'll do, I'll
video?
I'll give you a number to the moderator. I'll send you a set of exercises on WhatsApp, a document there, so you can just follow these at home, right? I can do that for you.
Okay, fine. Thank you so much. Thank you, sir.
So much.
Thank you, doctor.
We can take one more question.
Hello.
Yes, Gopal, go ahead.
Hello.
Yes, Mr. Gopal, we can hear you.
Actually, my question is, I sometimes back I made a road accident on my left leg. Several injuries are there, and after a long time, I am now suffering from acute arthritic pain, and my left leg is shortening by 1.5 inches. Actually, I want to take advice of customized shoe and other things so that I can walk properly. I have got several problem. I want to go and had a talk with doctor regarding this. Do you have any customized shoe facility in there?
Yeah, Mr. Mukherjee, let me take that. And I do get a lot of orthopedic patients who have shortening due to trauma, post-traumatic, like the one that you have, and it's quite possible to correct the imbalance by giving you customized insoles. And for that we need you to drop down. Are you based in Kolkata?
Yes. I am residing in Kasba only, and very nearer to your Acropolis.
Very good. So one day you drop down, call up the clinic and drop down. I'll see you, and of course we can solve your issue. I don't think it's a problem.
Okay. Okay, thank you.
Thank you, Mr. Gopal, and thank you, Dr. Nag, for your answer. So we are towards the end, and I would like to thank you all for joining us today. If you have any question, you can call us or you can email us. We will share the I'll share the email address, the phone number with you. Please note it and stay safe.
Hello, ma'am. Can we have a question?
Yes, sure.
Yeah, we are trying to reach you on the chat box, but unfortunately we have not received any response actually. But nevertheless, the problem is my son is 13 years old.
It's from Sweetie Bose actually. My husband is talking to you.
Myself is Shumotho.
Yes.
I know this session is not about the young kids basically.
No, please carry on.
Yeah, but the problem is there is a problem with my son's walking posture, and we visited CuraFoot last December. I stay overseas, and we have been given a support like AFO, which basically my son is not comfortable to wear with, and we tried because the AFO size is so big, and he's not comfortable. And since we are at home now because of the COVID situation, and he is always, on his chair and bed and all this, he cannot use that because we are not getting that bigger size of shoes also. So the problem is we are not seeing any development for his posture, and we did all the filming, the walking training, and everything there in the Acropolis Mall.
So where are you based?
I am in Dubai actually.
Okay, so I think these AFOs and sometimes there are continuous modifications and fitment issues which do happen with AFOs, and we keep working with our patients at CuraFoot Clinic. Unfortunately, during the lockdown, everything's got every schedule has got disrupted. So we would love to see the AFO and figure out what more we can do for you. But
I can send the pictures of the AFO.
No, Mr. Bose.
Yeah,
sending pictures, of course, please send. We'll have to see them. But we want to solve the problem. So we want to have it once the flight opens. We can.
Sorry to interrupt, sir. Actually, we want a proper treatment for him. So we got it, and we were told that it will be very thin, and he can wear it under the socks and all. He can continue his school with
Madam,
that.
I
But
think,
the child goes out since morning. Till evening, he comes back at home. So it's really difficult for him to carry whole day. It's so heavy and big, but we are at home and there is no support, under that AFO. It's really very slippery, and we are not getting any proper sleeper or whatever it is. They have told us we can take a keto or something like that, but it is not able. We are not able to adjust with that, and he is not able to use So that is why we want a proper treatment for that. For that, where we can, contact.
Yeah, I mean, we don't know actually when we can finally go back to India because of this situation.
Unfortunately, we can't help you with the fitment issues right now because of this situation where we can't see you and you can't see us.
I do understand. I do understand.
But I would love to help you if there's any way.
I do understand.
If there's any way you can physically send the A4 to India via courier, we'll try to see what we can do for you.
Yeah, that's fine. But I mean, what I like to get a suggestion from your side is, are there any exercise? Should we follow that, or
let's do one thing. I think outside of this webinar, let's catch up one day on a WhatsApp video call and let me see what's. I don't remember. Did I see your son? I didn't know.
No.
Yeah, so I can't say without seeing your son.
Yeah.
So one day, let us catch up over WhatsApp video and let me see if there's something that we can do sitting far off, remotely in Dubai, and we'll definitely work out something. You can do it.
No problem. Thank you. Thank you very much.
Thank you so much for reaching out. Thank you so much.
Thank you very much.
Hello, this is Madhumita again.
Yes,
can I please ask a question?
Yes, ma'am. Go ahead.
Actually, my mother is 80 years old. She's in Calcutta.
Okay.
And she has degenerative osteoarthritis with ulcerative colitis and high blood pressure. She has severe pain all over her body now. She's a little bit in a lot of pain. So she's very reluctant to really stick to any medicine in general. Is there anything that you can suggest that she can do?
I think Dr. Bose can take the question. Tanmoy, are you still there?
Yeah, I'm there. I got the question. Yeah, 80-year-old female who has got an ulcerative colitis, and she is having osteoarthritis. Now, ma'am, I just want to tell you that paracetamol or acetaminophen is a medicine which is extremely safe at her age, and we use it frequently. It can be taken as up to 4 grams per day. That is 1,000 milligram, or we don't get Calpol 1,000. We get Pyrogesic or Paracef, or there are other paracetamol brands. You get 1,000 milligram. Paracetamol is not an excellent painkiller because it doesn't have any anti-inflammatory property. It is basically antipyretic. It reduces fever. If you give it at a dose of 1 gram at least 3 times a day, she will get some benefit from she is suffering from right now. That is basically a very over-the-counter communication which I am giving it to you. Otherwise, ideally, I should have seen the patient, or somebody should see the patient and evaluate the entire medical history.
Actually,
Now, just allow me to speak, ma'am. Whenever there is a pain everywhere, we try to define whether it is limited to the joints or it is outside the joint, that is soft tissue, or if it is involving both of them. So a diagnosis prior to any treatment is must. Otherwise, it's basically a symptomatic treatment, and the medicine, whenever she's on medicine, she's temporarily better, the medicines are off, she's bad. Again, medicines on, she's good, otherwise she's bad. So you need to find out a diagnosis and find out the solution in case we have one. Hello?
Hello, is it possible to contact you, Dr. Nag? Dr.
Dr. Bose.
Sorry.
Yeah. You can contact with the CuraFoot care, because the clinic which is there in Kasba, I am available there. So you can talk to them and arrange if she can be transported from where she stays to the CuraFoot clinic. I can give a consultation. I can see her and evaluate her accordingly.
Is it possible to do a video consultation?
Video consultation is possible, but once again, I will tell you that a physical consultation is much better than a video consultation. Because in physical consultation, you just touch the patient and see whether that particular area is painful or not. In video, we just get the complaints. So clinical examination is good. Otherwise, you can go for a video consultation. They have an option. They just shared the screenshot how to go for a video consultation, so you can go for it.
Okay. She stays in Thakurpukur Housing Society in near Tata Cancer Hospital. So what is the closest clinic to that? Which is your closest clinic to that? Near Behala.
Yeah, she's asking what is the closest CuraFoot clinic near Behala?
You would have
share the. Yes, Sudarshana, go ahead.
Yes, you would have to come to the clinic at Kochba.
At Kochba. Okay. Fine. Thank you so much. Thank you.
Thank you, ma'am. I'll once again share the phone number for WhatsApp for video consultation and the addresses, clinic addresses.
Okay, fine. Thank you very much.
Yeah. Kindly note the phone number. And the clinic addresses. I hope everyone has noted the phone number and the addresses. So thank you so much for joining us today. Yes, ma'am.
Pardon, which is the one at Kochba near Acropolis Mall?
Yes, ma'am. That is the one.
Okay, fine. Thank you.
So thank you everyone for joining us. We have shared the phone number. You can get in touch with us. You can email us. You can visit our website, and we'll be so happy to help you. Thank you so much.
Thank you very much.
Yeah, thank you everybody.
Thank you, Dr. Nag. Thank you, Dr. Bose, for joining us today.